Hi there, we are live. I'm just checking that we've got the right link in the group. Bear with me a second. Because normally I can see comments and things and I can't see anything this morning, so we'll just check that. Hold on a sec. Yep, that's all good. Cool. Okay, we are definitely live. Cool. Okay, so welcome back. We've got this is the last one for 2023. Morning, Stevie. Oh, good. Someone is here. It gets a bit boring when I'm just talking to myself. Yeah. So oh, we've got a few more popping in now. Good, good, good. Yeah, last one of 2023. So we obviously did quite a long session on the foot and ankle. I think that lasted about 8 episodes. I think. This one I think we're into number 4 on the knee already, because I think we did. Maybe this is the 5th one. So yeah, we're every year. Good morning, Martin. Good morning. Every year we try to improve the information that's coming through and try to provide as much relevant information as possible and different ways to teach things as well. So it's like I say, not just looking at the anatomy videos, which is really interesting, but also just kind of and hopefully the reason why I'm saying this is because hopefully today's session will just make you think a little bit differently about how to learn the anatomy of the thigh in particular. And just wanted to say that you may have seen me using the terminology thigh and leg. So in anatomy, the thigh is kind of hip down to the knee, and then the leg is the knee down to the ankle. So although we say leg, but we often mean the whole leg, but in anatomical terms, the leg is the shin, okay, and then obviously the thigh is the femur. Good morning, hi Penny, good to see you there. But it comes up with the what do you call it, like the not phonetics but the spelling out the kind of emojis that you're using. Just made it face blue smiling. Good, good, I'm glad you did. So let's have a look at we'll just do a little bit of a recap of where we were. I'm just going to scooch back a little bit. So we had a couple of why is that not doing that? There we go. Yeah, we had a couple of muscles that we added on from last time, which is muscles from the leg, and then we looked at these terms as well. So just get rid of the clicker. There we go. So the anything with genu, genicular, geniculate, geniculum, all of that is to do with the knee. Okay, so it pertains to the knee, and you'll see that as we go through some of the some muscles, but especially the blood supply around the knee, and we'll introduce you to some of those today as well. So yeah, a little bit of a recap then. So we looked at gastroc, and this came from the last session we did on the foot and ankle. Because obviously this was covered quite a lot in there because it forms the Achilles tendon that attaches onto the calcaneus. But with the gastrocnemius, it also crosses the knee joint and attaches onto the posterior lateral and medial condyles of the femur. Okay, so right at the back of the femur. And whilst the main role of gastrocnemius is to plantarflex the ankle, it does have a role as well in flexion at the knee, but it's a very weak knee flexor. Okay, so yes, it will be involved, and there are some other weak knee flexors as well, which we're going to look at. But yeah, the main flexors of the knee will be the hamstrings. But if you've got a problem with the hamstrings, you'll still be able to flex the knee because the gastroc and another muscle, which we'll have a look at in a second, will help out with that job. Good morning, Becky. Good to see you as well. Yeah, so with the just a quick one. So obviously next Monday going to be excited because hopefully Santa's been. So we won't be here next week, and then the following week is New Year's Day. So we've got a couple of weeks break until we're back on the 8th. Okay, so we're back on the 8th of Jan, just to let you know what's going on over the next couple of weeks. Yeah, so yeah, so that's that, and that comes from the superior superficial, sorry, posterior compartment of the leg. Okay, so when we were looking at the compartments of the leg before, so we had to look at that last week. We didn't get to look at this one, and this is an important one for the knee. So you may have heard of something, and I'm sure I've posted this in the group before. It's called the screw home mechanism of the knee. Bear with me a sec. I'll just grab a knee. Oh, sorry about that. Okay, so just go back into the main screen a sec. So, well, when we were looking at the joints of the knee, I don't know whether you remember, but we mentioning that the condyles are different sizes from side to side. So if you have a look here, that medial condyle is a lot bigger than the lateral one. So what happens is the knee isn't like a hinge. Okay, so we're taught of it like a hinge joint, and it just does that. But it doesn't just do that. It also rotates, but it only rotates right at the end of extension. So when you extend the knee, because of the obviously there's a blooming great big screw here in the middle of the joint, so it won't contact the condyles of the tibia. But if you imagine these were really close together, as you start to extend, that medial condyle will contact the tibia first, and then there's a gap on the lateral side. Just pop that there. Hopefully we're still live. Yeah, I just had a weird message pop up then. Yeah, all looks good. So yeah, and it doesn't contact on this lateral side. So what will happen is the tibia will start to rotate, okay, and it will rotate laterally at the end of range, and that's called the screw home mechanism. So as you come right to the end, that medial condyle will contact the tibial plateau, and if it was just a straight hinge, just a straight up and down, it would just get jammed because that side is longer. Yeah. Because of the shape of the joints, it will start to rotate to form a really nice strong position at the end of that range. And what happens then as well is that's where your cruciate ligaments will then become really taut as well in that position. Okay, so as it comes up, it will then rotate and lock into that position. So that's the screw home mechanism of the knee, and that's where this little muscle comes in, because down here the popliteus will unlock the knee. Okay, so if we have a look at the action, it will medially rotate the tibia, okay, and laterally rotates the femur. Well, this is where it gets a little bit a little bit what you call it, confusing. So it depends on the position of the leg. Okay, so if your foot is in contact with the ground, then your knee will rotate one way, and if your foot is not in contact with the ground, then your tibia will rotate. So it depends whether your femur's moving or your tibia's moving, and that's to do with either what do you call it, open chain or closed chain positioning. Okay, so if your foot is in contact with the ground, then the tibia can't move, so then the femur rotates. But if your foot's dangling in the air, then your tibia can then rotate. Okay, so it can get a little bit confusing time to time, but basically what you need to know is that the popliteus muscle at the back, one of its roles is to unlock unlock the knee. So medially rotates the tibia with a flexed knee, laterally rotates the femur in full extension. But again, you're going to struggle getting that if it's in full extension already. Then it's already in a kind of that locked position. So yeah, the origin of your popliteus muscle is the lateral condyle of the femur and the lateral meniscus. So if we have a look around here, so that's where it's attaching up onto there, and then on that lateral meniscus here, so it's really really deep. You'll have your soleus and your gastroc around this region as well. So soleus will come up over here, and then the gastrocnemius will come and reach up over here as well. So it's a really really deep structure. Insertion point or other attachment, posterior medial surface of the tibia. Okay, so this area just here. So let's have a look at your popliteus. Where's it gone? From the leg. Hopefully this one. Here we go. Okay, so this is your popliteus. And there it is just there. So if I just pause that there. So there's your soleus muscle just underneath there. And you can see how close they are to each other. They kind of almost overlap each other as they're kind of the shape of them is at the top. It looks as if it probably one day was the same muscle, but it's just split. Okay, because they're so close to each other. Look at the outline of popliteus there, and then the outline of soleus there. So there's the attachment point there. So posterior tibia, and then it will come up onto here. Okay, and that's onto your lateral femoral condyle. So there's your popliteus. It will go through your joint capsule. So obviously something you don't see on the dry bones is the capsule and the meniscus. Let's just go back one, see if we can see it on there. I don't think we can see it on that one. No, but basically that will come up really really close to that lateral meniscus and close to the posterior cruciate ligament at the back. I don't know whether you remember that, but there's an attachment of popliteus onto those onto the posterior cruciate area and the posterior horns of the meniscus as well. So it goes really really close to the back of the knee just there. So over the top of that area there will be your gastrocnemius. So it's underneath that. Okay, so that's your little popliteus muscle. So that's that one, the knee unlocker from the screw home mechanism. And then we've got this one as well, the last one that's coming from the leg or going to and from the leg is plantaris. So this is a really really small muscle at the back of the knee, but it's got a massive long tendon. And again, we talked about this very briefly when we were looking at around the ankle, because this tendon runs medially to the Achilles tendon, and quite often it can be misdiagnosed as an Achilles tendinopathy. Okay, but actually it's just an irritation to the plantaris. I mean, rehab wise, it doesn't really matter. It's less of an issue, I guess, if you've got a plantaris problem. But rehab wise, you just do the same thing anyway. But on scanning, you can see that if there is a problem with plantaris and then no problem with the Achilles. So Penny's just asked a question. If you have a lateral meniscus tear, would this affect the popliteus? What other structures could be included in this? If you had a lateral meniscus tear, would this affect the popliteus? Possibly. Yeah, it depends on where the injury is, I would say. So if it was directly related to where the popliteus attached to the meniscus, then yes, yeah. Am I right in saying that plantaris is absent in a percentage of people? I don't think everybody has it. I think it is one of those muscles. It's like fibularis tertius, where you may have it, you may not. But I'm not sure of the percentages. But it's a pretty useless muscle, for want of a better word. It's got a really, really long tendon, so can't really generate much force. To be able for this to be able to generate force, you'd need some kind of sesamoid bone in there somewhere, just as a pivot point. But what it is useful for is grafts. So if you have a hand injury, then often they'll harvest the tendon of plantaris, because again you can get away without it, and they'll use it for tendon grafts in the hand. So yeah, I'm not sure of the percentage of people that have or don't have it, yeah, I think it is one of those. Longest tendon in the body, yeah, I think it is. Yeah, from memory again. Don't know what for sure. I'd have to check. But from memory, I think it is. Yeah. So yeah, you can see tiny little muscle up here, really long tendon, and then it emerges on the medial aspect of the Achilles. Let's just have a look. Have I got a video? Yeah, I have. Yeah, I thought I did. So here's plantaris. Some good questions today. So here we go. So that's the picture that you've just seen, and there it is just there. So obviously crosses the knee, so that's why I've included it in the knee section. There's your popliteus just underneath, and there's your soleus. And it attaches right up there. Okay, so it attaches quite high, lateral supracondylar area. Let me just pause that there. So if we have a think about the layers that you have to go through, so there's your plantaris muscle, and then the tendon starts around that area where popliteus is, and then it's got this really long tendon, and that muscle underneath there, that's soleus. So on top of that would be your gastrocnemius. So you wouldn't be able to palpate that tendon, okay, and you'd struggle palpating specifically the muscle body, muscle belly as well, because your gastrocnemius will come up over that region too. So it's quite again another quite a deep structure as it's passing through the leg. So there it goes on its journey, and um, it stays laterally and attaches to the calcaneus. Yeah, sometimes joins with the Achilles as well. Okay, sorry, medially, not laterally. Okay, so it's often on that medial aspect. So when you're palpating the Achilles, if the inside of the Achilles is quite tender, it may be a plantaris issue rather than an Achilles one, and that's just being like pernickety really. Because again, like I said, it doesn't really matter with the rehab, because the rehab's pretty much the same. So those are the muscles for the that come from the leg or attach across the knee and onto the leg as well. And then we start to move into the compartments of the thigh. So this is the bit that I think is really quite interesting, and it's only as I kind of researched for Learn Anatomy Online over the last few years that I've kind of realised that there were these compartments in the thigh, and thought about teaching it in this way. So hopefully you'll find it useful. Because we've all heard of the compartments of the leg, and we talked about those quite a lot. But I think this really helps you kind of visualise exactly where things are in the leg. So the thigh, sorry. So these are the three compartments of the thigh. So they've color coded them for us, which is nice. This picture's a bit weird because you never have a down up view. It's just a bit weird. When you do a cross sectional area or something, it's usually a top down view. So I would say it's easier to think of this image as the top down view of a left leg. Okay, so if we have a look here, so imagine someone sliced through your left leg and you're looking down at what is there. So we've got this green area that's the medial compartment. So these are your inner thigh muscles. Then you've got all this blue area here, which is the anterior compartment, and then this pink area, which is the posterior compartment at the back. So I think it's easier, like I say, just to visualize it, thinking left leg top down, because that's usually how we see cross-sectional areas. So there's your femur, just there. And something that we looked at last week, which is the IT band. So if you have a look here, so that white area there, that's your iliotibial band. So that's the thickening of that tract that runs down the outside of the leg. But what I want you to do is just follow that white line around, okay, and look at it. It goes all the way around the whole leg, all the way around, and then back again. Okay, so this is what I was saying last week. So the IT band is just a thickening of the fascia that surrounds the whole leg. Okay, and then that goes all the way down into the into the shin as well. Okay, around that area. So the whole thigh, the whole leg, everything is covered in this ring of fascia. Okay. But then what I want you to look at is this bit here. So this bit I was talking about last week. So as we get to this area here, before we get to this posterior compartment, it's divided. So the anterior and posterior compartment is divided by this white line just in there. And that's the lateral intermuscular septum. Okay. So, and we talked about this last week. So this is like if you imagine a Trivial Pursuit wheel, okay, and you're putting your cheeses in, you've only got 3 cheeses in the thigh. You've got this big blue cheese here, then you've got a little green one, and then a little pink one there. You've got the history one there. So this one, I'd never ever choose pink on Trivial Pursuit. So yeah, so we've got this bit here all the way around there, and then that then immediately attaches to the femur. Okay, and then if we follow that around, so if we come all the way around here, all the way around there, and then we've got another septum here, into there, okay, into the femur there, and that's your medial intermuscular septum. So that wrapping around there, and then that, and then all the way around, that's one big cheese wedge. Okay, and in there, look at all the muscles that we've got. So we've got sartorius, we've got your vastus medialis, rectus femoris, vastus intermedius, vastus lateralis, and this is really important as well. Look at that vastus lateralis; it is huge, and it's not just lateral, but it comes around the back as well. So it's really close to this posterior compartment just here. Intermedius is massive as well. Okay, and we see it as just like this tiny little muscle, where when it's in the books it's like, oh, it's like the one that's in between medialis and lateralis, but it's huge. It kind of wraps around the whole femur. So yeah, that is one compartment there. And then the key thing, and this is pretty much true for everything, we've got an artery, a vein, and a nerve. Okay, so that compartment there, that anterior compartment, is supplied by that artery, that vein, and that nerve. Okay, so that these are your femoral vessels. So you've got your femoral artery, femoral vein, and then your femoral nerve. Okay, so that's a nice simplistic way to think about the whole of the thigh and all of the nerve supply to that area, blood supply to that area. Okay, so hopefully that makes sense. We're gonna focus on this anterior compartment today. Okay, so let's have a look. So this is one of them. So this is your rectus femoris muscle. So the main thigh muscle at the front of the thigh. It's different to a lot of others, or all the others in the all the others, nearly all the others. Most of the ones on the front anyway, because it crosses 2 joints. Okay, there are some other muscles that cross 2 joints, so I don't want to confuse you. But with rectus femoris, it's one of the most injured quad muscles because it crosses 2 joints. Any muscle that's biarticular has an increased risk of getting injured. Okay, and this is your these are your vastus muscles underneath. So you've got vastus lateralis, vastus medialis there. We'll have a look at those in a second. So if we have a look at where it's coming from, AIIS, so up here, but it doesn't just come from there. Okay, so there's a little, there are two little slips on your rectus femoris, and one of them goes on onto the top of the acetabulum of the hip. Let's have a look. Sorry, Martin, I've missed your question there. I've no idea what you're relating to. Doesn't it support plantar movement of the foot? I think you might be talking about plantaris. Yes, if you are talking about plantaris, then yes. Again, it's a weak plantar flexor of the foot. If you weren't talking about plantaris, then let me know and I'll try and answer that. Cool. Yeah. So insertion point, tibial tuberosity via the patellar tendon. So all of your quad muscles, the quadriceps muscles, anterior muscle group, attach into the patella and then down onto the tibial tuberosity. And we've looked at the patellar tendon already over the last couple of weeks. Okay, let's have a look at that. So here we go, hopefully. This one. Okay, so this is rectus femoris. So rectus means long, so it's like rectus abdominis, long muscle of the abdomen. This is the long muscle of the femur. So here we are here. Yeah, so this is the bit that's quite interesting because it's got two. Here we go. So there's your AIIS. So AIIS means anterior inferior iliac spine. So that's the iliac spine just there. The ASIS, anterior superior, is the really bony bit at the top of the pelvis that you can feel just here. AIIS is just underneath that, just in there. And then we've got a supra-acetabular groove. So supra-acetabular, we haven't really covered the hip yet on this turnaround, but the acetabulum is the hip socket, and there is a little groove at the top of the hip socket where your rectus femoris will attach onto. So it doesn't just attach up here onto the AIIS, and there is a slip that comes off into the acetabulum as well, or into the top of the acetabulum. So you can see it just coming off there. There it is. And sometimes people can have that kind of real deep ache in there and what seems like a hip problem, but it might actually just be the attachment point of the rectus femoris. Okay, and you can play around with the position of the hip into internal and external rotation to because if you go just trying to think of it, which way would do which. Yeah, if you go internally, then you're going to slacken the AIIS section, and then if you go externally, external rotation, then you're going to tighten it. So either way will change the feeling of rectus femoris. So sometimes you can change the position of the leg whilst the knee is flexed. So you put a stretch through the rectus femoris, and the hip is in extension, and then you just get I don't know, you just get a different feeling. So if you're doing METs, that kind of thing, it's worth just playing around with the rotation of the femur in those different positions to see if that makes any difference to the sensation that they get. Because sometimes it, like I say, it's a rectus femoris issue, which is quite common because the rec fem, like I say, gets fatigued quite quickly as well because it's biarticular. So yeah, it may be worth adding some variation to the movements to try and pin down exactly where somebody is getting their symptoms. So yeah, there's your patella. There's your vastus medialis just there. It's coming up here. That's your rectus femoris. So all quad tendon just there. Yeah, cool. So that, I think the main bit for me, well, the different bit is that little slip of tendon just coming up there. Okay, so you can see the main one onto the AIIS and then that little slip coming across there. Okay, so it's actually got two heads on that rectus femoris, which is quite interesting. Cool. So that's one of the muscles of your, just go back, your anterior compartment. Okay, so that was the most superficial one. So that this vastus rectus femoris, sorry, this one here. Okay, cool. So let's go through. There we go, and then onto vastus lateralis. So this one here is massive, absolutely massive. So vastus obviously means vast. So it's a big muscle, and it's lateral. Okay, so it's on the lateral thigh. And if we have a look at where it contacts, so there's the intertrochanteric line. Now that, again, if we go back to our kind of bony anatomy, which we did a few weeks ago, just switch onto this. So this is the back of the femur, and I don't know whether you can see it, but there is a really, really long line. Just trying to get an angle. I don't think you're going to be able to get the angle, but if you feel on the back of a model of a femur, you can feel this ridge along the back of it. Okay, and that is where your vastus lateralis will attach. So there's a really, really long attachment point. So even though it's in the anterior compartment, it wraps around onto the back of the femur. Okay, so it's huge, huge muscle. It also goes up to your greater trochanter, and again something that we've not really really covered, but it's this area here. Okay, so that's the bony lump on the top part of your femur. The gluteal tuberosity, so that's around this area here on the back of the femur as well, where the glutes attach. Lateral lip of linea aspera. Yeah, so that's that raised area on the back of the femur. Okay, cool. Let's have a look at that. There's vastus, hopefully. Oh, I'm doing both at once. Okay, hold on a sec. Let me just introduce the next one as well. Okay, so vastus lateralis and then vastus medialis. So this one's on the inside of the thigh. Medial portion of intertrochanteric line. So that's coming up here in between the trochanters, intertrochanteric. Medial lip of the linea aspera. So on that line on the back of the femur, linea aspera, all the way on the back there. And then the medial supracondylar line. So just get the right area. Here we go. So this is the supracondylar area just here. Okay, so it'll attach onto there as well. That medial aspect superior to the condyle, so supracondylar, just there. Attaches into the tibial tuberosity, so that's down here. Okay, so your where your patellar tendon is, and then obviously it will extend the knee. So your vastus lateralis and vastus medialis don't cross the hip. Okay, so they don't go above that hip joint, so they have no influence on movements of the hip. What they are very, very powerful extensors of the knee. Okay, so that's their job. So let's have a look at those. Go back to that video again. So this is lateralis and medialis both together. Okay, so here we go. So there's your medialis, just in there. And then there's the lateralis just there. And again, I think we kind of underestimate how massive this muscle is. Look at it. It's absolutely huge. So wrapping all the way around onto the back of the femur. And there's medialis. They're kind of nearly wrapping around the whole leg. Okay, there we go. So there's the intertrochanteric line, and then it comes around and down that linea aspera, just there. And then there's the other one. So look how close they are to each other. Okay, so there's your fibula. So that has to be lateralis attachment point, and that has to be medialis attachment point there. So medialis attaches onto the other side of the linea aspera. So there it is there. So linea aspera is that white line, so raised line down the back of the femur. So, and again, we think of them as anterior muscles, and they are predominantly, that's where we see them, but they wrap all the way around the back of the leg, yeah, or back of the thigh. So they are huge, absolutely huge. In fact, I'm just going to go back to this one. Yeah, that's probably the best picture of it just there. Because sometimes, especially when you're in the labs, you get a bit confused and you think, oh, that looks like a hamstring. Okay, there we go. Okay, so look at that. Come all the way around the back there. So that with a very, very small gap in between the two. Okay, yeah, and then there's the attachment point again. So that's coming up into the gluteal region and that intertrochanteric line, and then all the way down linea aspera, and then same with the medialis as well. So again, medialis is like right in your kind of groin area, like, yeah, all the way up there and then all the way down before it then kind of wraps around and then over the front of the knee. So huge muscles, those ones, and again, it's quite mad to think about how far they come round. We've got intermedius, but I don't have a video for that one. So intermedius again is a huge muscle. We saw that on that with the compartments, that top-down view. So you can see that's a massive contributor to knee extension as well. So anterior and lateral surface of the body of the femur. Okay, and look how high it comes up. So again, there's your greater trochanter just there. That's that kind of intertrochanteric area here, and then it goes all the way down, okay, and then merges into rectus femoris, which is on the top of it. So this is deep to rectus femoris. You can see there, that's like a cut tendon of rectus femoris, and then with vastus intermedius underneath. So these are really big muscles coming down here. Now, this was one that, again, you can't usually see this on dissection either because it's just so small. But this is the articularis genus. So we talked about anything to do with genicular, genus, genome, being to do with the knee. Okay, so this is a really small muscle that attaches onto the top of the suprapatellar pouch or the suprapatellar bursa. And if you remember what we were saying, I think it was last week, is as the knee goes into extension, what this muscle does is it pulls your bursa out of the way of the kneecap so it doesn't get caught. Okay, so it will sit on the front of your femur, just there, and then the attachment will attach onto the top of the bursa. Then as you extend the knee, it will just lift the bursa out of the way. Okay, some crazy. Okay, and again, like not very many people have heard of that one. So articularis genum, and then we're on to the last two for this session. So we've got sartorius. So this is what I was saying, that most of the muscles don't cross the knee and the hip, but these two do. So we've got sartorius here, which is a muscle that starts laterally. So it starts on your ASIS, comes all, it's very superficial. Okay, so you can often see this one, especially in footballers, and then it attaches onto the inside of the tibia. Okay, just there. So that's your what we call your Pezanserine area. It's where your Sargent group of muscles attach. So sartorius, gracilis, and semitendinosus. Okay, so SGT, sartorius, gracilis, and tendinosus, semitendinosus. So those all attach into here. So that's your sartorius muscle. And if we have a look at what it does, it flexes and medially rotates the knee. So this was quite commonly called the tailor's muscle because of the cross-legged position that they would sit in for a majority of their day, and it would then overdevelop those muscles. So they had quite a pronounced sartorius because of what they did. So the body adapted to what they did. So there's your tailor's muscle, the sartorius. And then I'll talk to you about this other one. Bear with me a second, just see if I can find that, because the video's got the two together. because I couldn't separate them out. Here we go. So although it's part of a different compartment, we're going to have a look at this one as well. So this is another one of the Sargent group. This is your gracilis. So it attaches onto the your pubic region. Okay, so inner thigh area, down the inner thigh, and then into the pes anserine area. So exactly the same area as that sartorius. So that's why we've kind of grouped these two together. So body of the pubis, inferior ramus of the pubis, so the bottom branch, and then and then it comes straight down and into there. Penny's just asked, do you have a similar video that shows the connections of the hamstrings and adductors too? Yes, yeah, that'll be on the next section. Yeah, we'll have a look at that definitely, especially adductor magnus, because adductor magnus kind of, it's one of those muscles that is in the medial compartment but shares a nerve supply in different parts of the muscle. So it's considered to be a hamstring in certain portions and an adductor in others. Okay, so we'll have a look at that. Sartorius Taylor's muscle, yeah, because of that cross-legged position. You'll see it's quite pronounced as well in footballers. Yeah, so because of the action of kicking a ball or passing a ball, that is flexion and external rotation, and so they've got overdeveloped a sartorius as well. Cool. Okay, so it's difficult to see how they help to flex the knee. Are we talking about the gracilis and sartorius, Jane? I think we are. So they will only flex the knee once it's started to flex, if that makes sense. So if it's already unlocked because of the position of the tendon, because the tendon comes around the back of the condyle, then the moment arm means that it can pull the tibia into flexion. If the knee is dead straight, then you're going to get more of an adduction type action. So it works they don't work in isolation basically. So if you were if you were thinking about flexion of the knee, especially with this one, if all other muscles were knocked out and you couldn't do anything with them, you would struggle to flex the knee from an extended position. Okay, but if the knee was already slightly flexed, then that would have a better chance of doing it. Okay, so it's not a very strong flexor of the knee. This is more an adductor, just because of the position that it's in. Okay, but yeah, you're right. It's same with sartorius as well. If we just go back to that one, yeah. So, but if you have a look, there's a slight kind of kink in the tendon. Yeah, so it kind of wraps around the kind of back of the condyle a little bit, and because of that, that's how it generates that small amount of force to be able to flex the knee, but only really when it's already slightly flexed. Yeah, it's a good observation. Cool. Right, let's have a look at this one. So here's sartorius and gracilis. Okay, yeah, so sartorius is in the anterior compartment, gracilis in medial, and then there's your sartorius there. So that's one of the most superficial muscles that you can see. Vastus medialis just here. So that's what it looks like in the textbooks. Oh, just go back one. There we go. So you can see it just there. Yeah, and it's because it wraps around. So can you see as it's wrapping around there? That's why we get that element of flexion out of the knee. So if it was kind of like a straight line down, then it wouldn't be able to do it. But because it bends around a corner, it's got the position to be able to assist in flexion. Same with the gracilis. Okay, so because of the position behind that condyle, it's able to then generate the flexion movement. But again, very, very weak. Yeah, so there's your gracilis just there. as well, which is there on the image. So just pause. Oh no, good. So here's your sergeant group. Okay, so you've got the Pezanserine area on that medial part of the tibia. So sartorius, gracilis, and semitendinosus all in that area. So we're just concentrating on the sartorius and gracilis at the moment. But these form the border. If I just go back up there. So when we go back to when we go to the hip, can you see this area here and then coming up here? And then that line across there with the pelvis. So we've got a kind of triangle that's forming here, okay, and that's quite useful for later because when we look at something called the femoral triangle, because these muscles help to form the border of that triangle. So just go back again. Okay, so there's your sartorius over the top. Vastus medialis just there. So VMO is vastus medialis oblique, because the fibers are oblique. There's your gracilis down the side there. Okay, so that's one of your most superficial adductor muscles. And then again, they attach down onto that Pezanserine area, which is this area here. So that's your sartorius, gracilis, semitendinosus, all attaching into that area just there. And there's a little bursa usually around there as well. It can be quite tender, which is normal really, because there's quite a lot of action going on there. There we go. Cool. So that finishes it for this year. I hope that was okay. We've we've done the anterior, most of the. I think we've done the anterior compartment pretty much. If I've missed bits, then we'll add them into the next session. So we've got a couple of weeks break. Back on the 8th of January. No worries. Have a good Christmas and a good New Year. Thank you, Martin. Hopefully you've enjoyed all the sessions this year. I'll be back on the 8th of Jan, ready to go again. See you then.